Hello everybody, my name is Denise Wilson. I'm working currently as a community matron, senior community matron. Most of you will know me, I think. In an attempt to unravel some of the issues surrounding the fast track process, I've developed this short audio presentation which shouldn't last any longer than about 15 minutes. So just an overview of some of the areas I plan to cover. Important facts about the fast track pathway, consent, completing the fast track pathway tool, completing the fast track care plan and support plan, a little bit about personal health budgets, the fast track review form, and perhaps other things to consider when we're looking after our end-of-life patients. So, some important facts about the fast track. The eligibility. The only requirement for fast track funding is that the patient has a rapidly deteriorating condition and may be entering a terminal phase. There are some common misconceptions about the time frame of this. Some people think it's 2 weeks, 6 weeks. There is actually no time frame in terms of days, weeks or months of life, months of remaining life. Entering a terminal phase is not intended to be restricted to those where death is imminent. So it is important to complete a fast track early enough for the patient to be able to obtain a package of care in a timely manner. So when would we complete the fast track? The purpose is to obtain care quickly, without delay, whether this is in the patient's own home or a 24-hour nursing care home. It should also be completed if the patient is receiving a package of care, as they may be funding this themselves or it may be funded by social care. Who can complete the fast track? Any appropriate clinician can complete the fast track. It is a misconception that it has to be a nurse. It can actually be a doctor, but it does have to be a registered nurse, not a non-registered nurse. The clinician needs to be someone who has an understanding of the patient's diagnosis, the treatment and their care, and they need to be able to provide an assessment of why the individual meets the fast track criteria. So just to go through some of the documentation, I am going to go through it in more detail, but firstly I just wanted to show you where to find it on System 1. So I've just brought up a test patient. And if you just go down the clinical tree, you'll find the CHC fast track link. Just right click that, left click onto that and go on to applications and forms, and this is where you'll find all the documentation for all the continuing healthcare documentation. The ones we'll be looking at are the consent form, the fast track care plan and the fast track pathway tool. Okay, so we'll come out of System 1 and we'll go back to the presentation. Okay, so firstly, the consent form. Okay, so at first glance it is quite a lengthy document, but there are only a couple of sections that need to be completed. The first couple of pages are the information about the consent and what the patient is consenting to, and then we get on to the main body of the consent. So before the process can begin, it is important that you gain informed consent from the patient. It's important that the patient understands the purpose of the assessment and that you are happy for, and that they are happy for information about them to be shared with other health or social care colleagues. If, however, following assessment of mental capacity, the patient is unable to consent to the CHC process, consent can be given by you as a health professional in the patient's best interest, or alternatively, consent can be obtained from the patient's representative if they hold evidence of legal authorisation such as an LPA for health and welfare. Okay, so the first part here is the consent given by the person who has capacity. Part of the form is populated automatically. Okay, so that's all quite self-explanatory. The second part of the form is if the patient lacks mental capacity. Now in this part of the form here, this is the part where you do have to complete the mental capacity assessment. And if you're completing it as a professional, you're completing it in a best interest decision. Even if the patient doesn't have any representation any family or representative who holds LPA, it is still important that when you're making a best interest decision to involve the family or those closest to the patient in the discussions. Okay. So this section here is where you would sign as a professional, and normally you'd have a second signature if possible. And this part 3 is the legal representative, so a family member or a person who has LPA for the patient's health. Okay, so it does look quite lengthy to start with, but it is only 2 sections that need completing, depending on whether the patient has capacity or not. Okay, we'll just close that now. So on to the fast track pathway. This is the form. I'll just open up. This is one I've completed. It is a real case, but obviously it's been anonymised. So the areas in red are is actually what I've typed in myself. The rest of it is populated. Okay, so the first part is really just giving detail of the evidence for the fast track. So this is a man who's got adenocarcinoma of the sigmoid colon, widespread metastases, and it's really a bit of information about the reason for the package of care and just evidence of of his deterioration. I have put here that prognosis is felt to be around 3 months, but obviously this was following a conversation with the hospice consultant. If you're not sure, there's no time frame, but if you are unsure if the patient may be entering the fast track, terminal phase, then ask the GP for their opinion, or another medical professional that's involved with the care of the patient, and ask them maybe just to put a couple of lines in an email, just so you can include that in your evidence. I mean, other evidence to include would be things like that anticipatory medications have been prescribed, patient has a DNAR, that they've got PPC to remain at home, they might have an emergency healthcare plan. It's all supporting evidence which points to the fact that the patient is rapidly deteriorating and entering a terminal phase. So that's the main body of the fast track pathway. The rest of it is self-explanatory. It's tick boxes to clarify that you've explained the process to the patient or their representative, and then you need to sign and date that. You do need to fill in the equality monitoring form, or the application will be rejected. Okay, close that. So on to the fast track care and support plan. Again, this is one that I've completed for this gentleman. So the areas in red are the areas that I've had to populate myself. You do need to make sure that you do go through the form thoroughly and make sure that if there's any yes/no boxes, they're deleted, and that all the areas are filled in. Otherwise, the application will be returned. So this is the support care plan. So basically you're just really, if you imagine that this care plan is going to be sent to a care agency who have no knowledge of the patient, this really informs them of the care that's needed for this particular patient. So this is all quite self-explanatory because everybody's used to completing holistic assessments. It is important perhaps just to identify if there's anybody else that's going to be providing that care. So for example, it may be that in nutrition and hydration that maybe the family are going to provide meals, so you'd include that there. So it's not just the care agency that are providing the care. It would be if a family member is providing it, if another professional is providing that element of care, you could include it in these boxes. Medication management, obviously in the symptoms, obviously in this section you would record any particular symptoms the patient's having and any specific medication that they're using to relieve the symptoms. Okay, so that's all quite self-explanatory. And then in this section there's an area where you would tick either the patient is requiring care at home, which would be, you know, your traditional package of care, or if they're needing 24-hour nursing care. In this case, the patient was having care at home. If they were looking at 24-hour care and that was what their level of need required, you would tick this box and put the postcode where you would like the home to be sourced. Obviously it's usually the nearest to the patient, but it might be nearest to the relative. Okay, we'll come on to this, the descriptions of these notional budgets and the managed account and direct payments in the next couple of slides. And then in here you would put how many home care agency visits are required each day, and then how many carers at each visit, and then the number of district nurse visits each day, and then any interventions that are going to be provided by the district nurses. And then in this section you need to specify roughly how long each visit should last for. This part of the form is quite new to the new fast track care plan, and this is just to record where you'd like to record any outcomes that are specific to the patient or the family or what they would like to happen. So for example, the patient in this situation, patient and family would like to ensure that Andrew is safe at home, and how are we going to do this? So carers or hospice at home staff just overnight where possible to relieve the parents. And again, anything that's specific for the patient or the relatives you can include in here just to support the application. Informal family support, obviously this is where you just put perhaps a couple of comments about whether, you know, family are going to provide shopping, you know, perhaps they're going to do some housework, that sort of thing. Key safe and the code, and then your signature. And then at the bottom you'd put a cross next to the Wirral CCG section. Okay. And we'll come on to a fast track review in the next couple of slides. Okay, so just a quick look at the personal health budgets. Now this is new to the fast track application, and it's relating to the choice of funding. So a notional budget in summary, the continuing healthcare team would be responsible for arranging care and support for the patient. But this is based on the patient's wishes and as agreed in the support care plan. And this is the most commonly chosen option. So it's, you know, it's your traditional package of care. Continuing healthcare would arrange it, and they would commission that care agency and pay the care agency directly. The managed account is a third-party organisation, such as the care provider, who will then arrange payments for services that the patient is receiving, and the third party may charge for this service, so it is something that needs to be considered. And the final section is direct payments. So this means that basically the patient may want to receive the cash to buy in and manage services themselves. So in this type of funding, cash payments are paid directly into a bank account specifically set up to receive the personal budget. The patient can then choose how to spend the money to meet their needs set out in a care plan that you've provided. This obviously maximises choice and independence. What I would say is I think the personal health budget is quite new, and it's perhaps a little tricky to understand, so I would, if you're not sure, get some advice from the continuing healthcare team. Okay, so the fast track review form. Obviously this is something most people will be used to completing. Every 2 weeks the patient's needs are supposed to be reviewed. I know this often doesn't happen, but that's what's set out in the guidelines. At a very minimum though, they do need to be reviewed if the patient's condition changes, or if they need an increase or a decrease in their package of care, or they may need to be stepped up to 24-hour care. So it's quite self-explanatory. It's just a quick summary of the support that's being provided, quick summary of the current symptoms, the number of visits and how many visits how many carers that are visiting, and then really just more around just a brief description here to say why the plan needs to be changed. So this form would be then submitted to continuing healthcare team to review the care plan. Generally, it's the review is when the patient is deteriorating and needs an increase in the care. But like I say, sometimes, you know, the patient can pick up and they, you know, no longer need the level of care that had been first planned for them. Okay. So that's really around the review. I'll just show you something quickly, because often after completing a fast track care plan or the tool, you might get an email to say we need more information, we need more evidence, you know, something needs amending on the care plan. Just a little tip, and it's something that I do myself, because obviously you can't amend the documentation once it's been finalised on System 1. But what you can do is you can open up a document. So for the purpose of just showing you this, I'll leave the fast track review form open. But you can open up the document from System 1, and once you've opened up the document, you can actually copy and paste the whole document. So if you scroll all the way down, and I use Control-C, open up a Word document, a blank Word document. get there in the end. It's new, blank document. And then I use Control V to paste, and it brings up the Word the document, and then you can then type into it and amend. What you'd then do is you'd need to save it as a Word document and email it as an attachment to Continuing Healthcare, just via the usual NHS net route, not via System 1. It does save a huge amount of time. You don't have to complete the whole fast track application from scratch. We'll just close that down. Okay, so just one final slide. What else we might consider? Obviously this is a patient, we're talking about fast track, but this is a patient who is, very poorly, end of life. So just a few other reminders of what else to consider. Obviously, someone at this stage, they should have had a DNAR discussion with yourself or with the GP, and ideally that should be in place in the house. Is the patient coded on the GP gold standards framework? They should be, and they should be coded accordingly. Are anticipatory medications in place? Obviously another consideration, just future planning. If it's at the right time, then the anticipatory medications need prescribing along with a PMAC and left with the patient. Patient may need an emergency healthcare plan, which is a document that can be completed by the GP or a community geriatrician, and this is to try and reduce unnecessary and unwanted hospital admissions for a patient who is end of life. The palliative care handover form, that can be found on System 1, and that would need to be completed at any significant change and shared with the end of life facilitators and GP out of hours, and obviously the GP. I also send a task to the night service just to let them know there's a new patient who is palliative and potential requirement for clinical input overnight. And then just whether any additional support is required, such as Marie Curie or hospice at home, and then the DS 1500, has that been completed? If they're in the last 6 months, which obviously they probably will be if a fast track has been completed, then the DS 1500 should be completed. Or if they're already on a high rate attendance allowance, that you don't need to do that. Okay, so that's the end of the presentation. If you have any queries about continuing healthcare and the fast track application, this is the number for the continuing healthcare team, and this is their email address, and I'm sure they'll be able to help. Okay, thanks for listening.